Hello everyone, and welcome to this month's monthly members meeting. So today we're going to be talking about dysautonomia. We will be talking a bit about what it is and how it works. We'll also be talking about the dysautonomia that is most commonly experienced by people with chronic fatigue, fibromyalgia, and long COVID. So that's POTS and neurally mediated hypotension. And we'll be talking a bit about how to manage them. So dysautonomia is an umbrella term for multiple conditions which cause a disturbance or a dysfunction of the autonomic nervous system. The autonomic nervous system is responsible for regulating involuntary processes such as internal temperature, breathing patterns, heart rate, blood pressure, and digestion. So this diagram is a very simplified version of our nervous system, while still being quite complicated. It's not necessary to know all of this. It's just important to know that the autonomic nervous system communicates between the central nervous system, which is the brain and the spine, and the rest of the body, so that we can perform those involuntary actions such as breathing. The autonomic nervous system can be split up again into the parasympathetic and the sympathetic nervous systems. So those of you who were here for last month's monthly members meeting will find this quite familiar because the vagus nerve is a large component of the system. The sympathetic nervous system is aroused by stress or by a trigger that results in the fight or flight stress response and produces adrenaline. So that raises the heart rate, breathing rate, blood pressure, and dilates the pupils and so on. So when you get a fright, the sympathetic nervous system is what gets you ready to run or fight. Unfortunately, it is also activated by many modern stresses such as public speaking, or worrying about the bills. The parasympathetic nervous system calms the body back to a balanced state after the stressor or trigger has gone. So this is often known as the rest, digest, and repair system. Dysautonomia is a failure or an increase, can be either, of the sympathetic and parasympathetic components. And we're going to come back to this idea later on. Because the autonomic nervous system regulates so much of the body, the effects of a dysfunction of the autonomic nervous system can be correspondingly widespread. As you can see with this information from an image by Dysautonomia International, it can affect our brain, our heart, stomach, mouth, blood vessels, intestines, eyes, immune cells, gallbladder, skin, bladder, and more. So common symptoms, these are likewise widespread, so they include an inability to stay upright, a fast, slow or irregular heartbeat, chest pain, low blood pressure, disturbances in the visual field, weakness, breathing difficulties, temperature regulation problems, problems with the gastrointestinal system, mood swings or anxiety, sensitivity to sensory input like noise and light, fatigue and exercise intolerance, migraines, tremors, disrupted sleep patterns, frequent urination, and concentration and memory problems, often known as brain fog. So as I said earlier, dysautonomia is an umbrella condition. There are at least 15 distinct types of dysautonomia. In addition, illnesses such as diabetes, multiple sclerosis, and Parkinson's can also have dysautonomia as a secondary condition. For example, with chronic fatigue, fibromyalgia, and likely long COVID, some dysautonomia symptoms can be increased sweating, gastrointestinal symptoms, and frequent urination. In addition, it's quite common for people with these conditions to have POTS, which is Postural Orthostatic Tachycardia syndrome, and Neurally Mediated Hypotension, or NMH. And these are the two conditions that we are going to focus on. Now, this next bit is a bit technical, but it will help you understand the underlying mechanics of why POTS and NMH work the way they do. If you aren't interested in that, feel free to tune out and tune back in for management strategies. So, POTS and neurally mediated hypotension both have orthostatic intolerance as their primary symptom. Orthostatic intolerance is the inability to tolerate an upright posture because the autonomic nervous system is not able to regulate the heart and blood vessels properly. So the reason this happens is that when we stand up, gravity causes our blood to pull in our arms, legs, and our abdomen. In healthy people, the body releases adrenaline and something called norepinephrine, which causes the heart to beat a little faster and stronger and the blood vessels to contract, and that's what helps the blood return to the heart and the brain. However, when people with neurally mediated hypotension and POTS are upright, the pooling of blood is more extreme because the blood vessels are unable to constrict properly. So healthy people might feel a bit dizzy if they stand up too quickly, but they will quickly regulate themselves. With neurally mediated hypotension and POTS, this regulation is impaired. So, neurally mediated hypotension. This is an issue with the regulation of blood pressure. Hypotension is the medical term for low blood pressure, and in this case, it's mediated or brought about by the nervous system. So for those with neurally mediated hypotension, that lowering of blood pressure is because the brain sends out confused messages. So instead of telling the blood vessels to contract and the heart to beat more strongly, it does the opposite. It doesn't send out enough of that norepinephrine, and you get expanded blood vessels and a slower heart rate. So this leads to these symptoms of dizziness, nausea, fatigue, and fainting. Neurally mediated hypotension tends to come as a result of continued standing. So Dr. Ros Vellings refers to this as the third aisle of the supermarket. You might be able to go to the supermarket and you might be able to go around the first few aisles, but then you suddenly feel like the plug has been pulled and you just have to sit down. For those people with POTS, the heart rate is not regulated correctly. So upon standing, the lack of blood returning to the heart leads to a continued release of adrenaline and norepinephrine. The veins, for reasons that are currently not fully understood, they don't react normally to these substances. So instead of the heart rate increasing and the blood vessels constricting, you just get a continued increased heart rate without that constriction. So that's what leads to that abnormally fast heart rate. This abnormal increase in the heart rate is about 30 to 40 beats per minute within the first 10 minutes of standing up. So this is what leads to the name postural orthostatic, or induced by an upright posture, tachycardia, which means an increased heart rate, syndrome. So I've grouped these management strategies into different sort of categories to make them a bit easier to absorb, as we will be going over quite a few of them. But there will be overlap. These are not hard and fast categories. And as always, you'll find that some of these tips are really helpful for you and some are not. It's all about using what works for you. So as most of you probably know, drinking more fluid to ensure your blood volume is nice and high is a really good management strategy, and you want to be drinking at least 2 or 3 litres per day. This is going to help with your blood volume so that lowered blood in the heart and brain when you're standing is not so extreme. I know it can be hard to remember to drink all this water. Some people find those big drink bottles with the timestamps can be really helpful. Other people use apps. Also, just switching it up with some non-caffeinated herbal teas or sparkling water, it can just, make it a little bit less like a chore. Increasing your salt. So salt helps us retain fluid in the blood vessels rather than having it go straight through us. If you're drinking a lot of water, then that can actually remove that salt, those electrolytes from your system. It can flush them out. So it's really good to keep up those electrolytes to get the best hydration. Assuming you don't have high blood pressure, you can go about 10 milligrams per day over and above your regular intake. You can try eating salty food, or for the best absorption, I recommend getting electrolytes prescribed by your doctor. So these are great because they include a little bit of glucose, which helps the body to absorb that salt, and some potassium. So the reason it includes potassium is because extra salt can actually leach potassium. So if you're increasing your salt in other ways, it might be worthwhile to take a potassium supplement or to eat some bananas and kiwi fruit, which contain potassium. And maybe get your potassium levels checked every now and again, because potassium is really important for a healthy body. Symptoms tend to be a bit worse in the morning because you might have gotten a bit dehydrated during the night, and your blood pressure is often lower in the morning, so drinking water before you get out of bed can be helpful. Now, in terms of the types of drinks, I tried to find some stock images for this slide, and almost all of the drinks that came up were alcohol and caffeine. So that just shows, how much of it we tend to drink in the society. So it is better to limit caffeine and alcohol. So caffeine can be dehydrating. It causes you to need to urinate more often, and it can also give you false energy, which means you end up going over your energy limits without realizing it. However, it can raise your blood pressure, which normally sounds like a bad thing, but for some of you, it might be quite positive. Also, I do know that for some of you, your cup of tea or your cup of coffee is a really nice ritual that just brings some joy into your day. It definitely does for me. So just, in moderation. Alcohol, on the other hand, that is also dehydrating, and alcohol actually expands those blood vessels on top of all the other things that alcohol is infamous for. So limiting that alcohol is always a really good idea. Now, we want to ensure that we have good circulation and stop that blood from pooling. So one way to do that is by ensuring we don't get too hot. Heat, again, causes the blood vessels to expand. So having cooler and shorter showers and baths, dressing in layers so that it's easy to remove clothing when it gets too hot. And in the summer, you can use fans, a spray bottle of water for the face. You can get cooling towels that you just wet, put around your neck. It doesn't even have to be particularly cold water for them to work. They work amazingly well. Or cooling vests can be used. I know that heat is recommended for fibromyalgia and muscle pain. So if you are going to have a bath or a spa or a sauna, just make sure to keep really well hydrated, limit your time, get out slowly, give yourself time to recover, maybe have a cool shower afterwards. Pressure garments, they can be really helpful for helping get the blood back up the body, particularly socks and stockings, and sometimes abdominal compression can be really helpful too. But make sure to remove them before going to sleep. Small meals more often. This is because digestion causes blood to be diverted to the intestines. So you just want to reduce that impact of that eating and sort of spread it out. High carbohydrate meals have been shown to reduce blood vessel constriction in response to standing up. So trying for complex carbohydrates and less sugar can be helpful. Keeping your legs raised on a stool or leg rest can help reduce the effort of keeping that blood circulating. Also, in the case of a leg rest, it can help your leg muscles to be a little bit more activated so that they're able to help with that circulation rather than just having them sort of hanging down. Raising the head of the bed can be helpful if you struggle to get out of bed in the morning or if you need to get up a lot at night time. That's because having your head raised seems to help the body retain fluid at night rather than losing that into the urine. In addition, it helps reduce that shock of going from hours of lying down to standing up. And finally, massage can help with that blood circulation. It's also a really good way to activate that parasympathetic nervous system and just reduce that adrenal response. So movement is a bit tricky because on one hand, movement can make you worse, and on the other hand, it can make you better. So it's all about striking that balance of just enough, but not too much. So pacing yourself and not depleting your energy is, as always, very important. In addition to activating your fatigue, exercise diverts blood to the muscles, which means less for your brain and heart. So exercise can actually increase your symptoms. However, increasing your fitness level can help reduce the symptoms of POTS and help improve the efficiency of your circulatory system. In addition, the lower leg muscles can really help in assisting blood circulation by acting sort of like pumps. So exercise where you can, but do not go above your energy envelope, and be aware that it can exacerbate symptoms while you're doing it. Exercise that can be done reclining, such as yoga, or if you are able to, an inclined exercise bike, might be good types of exercise to try. Prolonged standing or sitting, being upright, can make symptoms worse, so avoiding that if you can. When you're sitting for a long time, you can try some simple exercises, such as moving your feet up and down at the ankle, crossing and uncrossing your legs, and tightening your abdominal muscles, and that can help the circulatory system get that blood back to the heart. And of course, making sure to change your position slowly so as not to shock the body. Just giving it time to adjust. If you do get a sudden onset of your symptoms, you can use some of the techniques we've gone over. So you can drink some water, have some salt or electrolytes, and a really quick and effective technique can be to just lie down, raise your legs up the wall, and get that blood back to your heart and brain. If you're in public and you can't use these techniques, then using your muscles to help your circulation again can be helpful. Crossing your legs, rocking up and down on your toes, tightening your buttocks and abdominal muscles, and clenching your fists. So just clenching and releasing those muscles can help with your circulation, just as we talked about with the movement slide. This is the final slide of self-help techniques. So studies have shown that people with POTS spend more time in REM sleep, and that is the dreaming, more active state of sleep. This reduces the amount of time spent in deep sleep, which means that your sleep quality is likely to be lower, and this in turn is likely to make your POTS worse. So ensuring your sleep quality is as good as possible can reduce this problem. Ensuring that you are in a rest and repair state before going to sleep with things like meditation or sleep apps can help. And you can contact your facilitator if you would like more information on improving your sleep hygiene. Pain, I know you're already probably trying your absolute best to manage your pain, but pain can activate your sympathetic nervous system. So managing your pain will also help calm that system and manage your POTS. For those with severe symptoms, medications such as fludrocortisone, which increases blood pressure, and metadrine, which constricts the blood vessels, can help, and low-dose beta blockers are also often prescribed. It's also helpful to be aware that medications used for other conditions or symptoms can affect your blood pressure and heart rate. So some antidepressants, for example, can lower blood pressure. So that's just something to keep in mind. And again, anything that can help activate that parasympathetic nervous system can also help with your POTS. So meditation, some light yoga, and breathing exercises can help. Now that was a quite information-heavy session, so I thought it might be a good idea to end with a bit of box breathing just for 2 minutes. Box breathing is a technique where you inhale, hold your breath, exhale, and hold again. And we'll just be using one put out by the University of Alabama at Birmingham. You can find it on YouTube if you'd like to do it again. thank you for joining us for this monthly members meeting. Next month we will be talking about occupational therapy sessions, and we hope to see you all there. Thank you.